Greetings, friend, from MEDSICON. As the organizing chairman, it's my pleasure to welcome you all once again to an event that stands by its quality and also for the students, by the students, and of the students. MEDSICON has a history, and I'm never tired of repeating it. I've done that in the past too. It all started in 2007 with my own undergraduate students who were very keen after I had seen one congress of the same nature outside. We wanted to start it, and this was the first of its kind in the country. Since then, we've been evolving, and in the process, we've reached a point where MEDSICON is a benchmark, and we keep bringing in newer dimensions to it each year. So the highlights of the conference would be, as always, the basic surgical skill workshop, which is one of its kind, very well known, established, and we generally have up to 300 students to cater for that, and usually there are about 400 plus that apply for it. So we are under a lot of pressure for that. And there we cover up the basic OT etiquettes, the suturing, knotting, tying of the knots, all types of suturing, then opening and closure of the abdomen on a simulator, making an anastomosis, repairing a perforation in the bowel, vascular anastomosis, vascular repair, controlling the hemorrhage, etc., etc. All this, sometimes if we have, the kind of students that we get every year, almost invariably we end up teaching them tendon repair using the Casper stitch. And a lot of you must have seen these videos on the YouTube. So it is not, this is going to be exactly as we do it. What are we going to add this time? We'll see if we can take select few to the main operation theater and show as to how it happens. Of course, basic life support is a standardized workshop that we do every year. We have, in addition, 3 very important workshops that we have added in addition to the ones we had last year. One is a workshop on proper history taking and examination in the for a medical students, and it's not just about surgery, all subjects covered. So we will have a 3 to 4 hours and nearly half the day focusing on how to take the right kind of a history, how do you make a presentation the correct way, and one correct way of presenting it in the exam so that you do well. We have, like last year, scientific paper writing workshop, which is again a very special workshop, which is going to be hands-on like last year. We're going to make it even more student-friendly this year by adding pre-conference questionnaires, selection of students for very special gifts and awards. And this time again, as the governor and president of the American College of Surgeons India chapter, and also as the international surgical advisor for the Royal College of Surgeons of Edinburgh, I'll be personally taking the conference to that level where it is internationally acknowledged. And we will be selecting, like last year, 20 scholars by their overall presentation, considering the events they have participated in. It's not one odd event that you do well. And we will be conferring the membership of the American College of Surgeons for the students, and we'll be sponsoring the affiliate membership of the Royal College of Surgeons of Edinburgh. A huge honor for any medical student. So this is what you're going to take away if you do very well in all the events by attending it in time and being the first one to come and register. Scientific paper writing workshop would give you an opportunity to learn from the experts about how to write a paper, how to review a paper, how to read a paper, which is also important, and eventually how to make it count in your career and in your curriculum, CV, curriculum YT. We have a workshop also. There are some minor workshops, which are gynecology workshop, which is very useful. We have a workshop in orthopedics on learning about the fractures, the management, the first aid, plastering, etc., splinting, etc. And then some interesting sessions where we will be testing you, but yet you will have a lot of fun. The jam session, which is totally medical, just a minute session, thoroughly enjoyed by all students. A medical quiz, it is not just confined for clinical subjects. It will have anatomy, physiology. It will be kind of your preparation for the next exam or the preparation for all the exams, considering all subjects. The quiz will be prepared. We'll have prelims and finals as we did last year. We have debates, and then the debates are usually very hotly contested, and we pick up the best scholar there, and there are lots of marks for how you do in your workshops and how you do it in your academic events. In addition to this, we have a very interesting session which we have added this year. One I told you was one I just mentioned was this history taking and examination, which is new and very important. The other one I'm just going to tell you. It is a chain reaction. Excuse me. The chain reaction is working on a medical term. So I won't open it all. It's more kind of a jam session for a medical student, so you would enjoy it. Example, you've shown a nerve, which is say musculocutaneous nerve, and then you got to be speaking about it. So this would be another exciting addition. We are going to have a convocation in the valedictory function, where the American College of Surgeons Indian chapter, some of the office bearers would be there, and we would be conferring these memberships in a real formal way, proper gown ceremony. So you should be all looking for it. You should all get registered as soon as you can. Before we stop registering, it's all physical event for the benefit of everyone. We are not keeping any virtual part to it, although some international speakers might be joining us virtually on communication skill workshop, which I forgot to mention, where you will be given a good exposure to how best to communicate in the field of surgery, medicine, gynec, or whenever you're dealing with a patient. There's an interesting topic we keep each year. It's an interactive session on career counseling, where we talk about what is it that you want, what is it that you can ask us. We'll get the best people to do it. So there is more to it. Maybe I've skipped a few points, but do join in early. Feel welcome to this premier institution that has been hosting it. It has been my singular honor and joy to do it for all these years, and I want to make it very special this year. With all of you coming, I'm sure it will become even more special. So once again, a very warm welcome to MEDSICON. The organizing team has got the blend of seniors and juniors, advisors, etc. It's a very exciting team of organizing secretaries and joint secretaries, and they are going to make sure that we not only have a great time academically, but also towards the end, culturally and socializing and camaraderie. You're going to have a wonderful cultural evening, and feel free to be part of it. Feel free to be part of all these aspects of the conference. Looking forward to having you all for this wonderful meeting. August is generally a little on the humid side, but traditionally we hold August. MEDSICON is each year August. So we are sticking to that first week of August, and I'm sure you're going to all enjoy the stay, the conference, and the camaraderie.